Okay, we're getting started again with the abstracts. And our next presentation is by Dr. Ritu Swali.
Hi everyone, my name is Ritu Swali and my abstract today is on treatment of hemosiderin staining with the 785 nanometer picosecond titanium sapphire laser in combination with the non-ablative 1550 nanometer fractional resurfacing laser. My co-authors for this abstract are Sushruti Rajadala and Dr. Paul Friedman. I have no relevant disclosures. So hemosiderin hyperpigmentation consists of golden brown deposits in the dermis. Typically, this is caused by iatrogenic reasons, stasis dermatitis, which can be seen in venous insufficiency, and hemochromatosis. On histology, we see dermal and perivascular siderophages with positive iron stains, but typically diagnosis is completely clinical. Hemosiderin's peak absorption range is in the 660 to 680 nanometer range. Prior studies have shown pretty successful treatment of cutaneous hemosiderin using the Q-switch lasers at 650 nanometers and 695 nanometer UV lasers, as well as the 755 nanometer picosecond laser. The 755 picosecond laser has also been used in combination with non-ablative 1550 nanometer fractional lasers for other conditions with dermal pigment. Our patient is a 27-year-old female. She's with a Fitzpatrick skin type 2 that presented with a 3-month history of a large brown patch on her right arm. She does have a previous history of iron deficiency anemia for which she had been getting iron IV infusions for many, many months. Her most recent infusion had some extravasation of the iron into her skin, leaving her with this discoloration. Since then, she had been using hydroquinone 8% cream twice a day with only mild improvement. This photo here is what we saw at baseline. For her treatment, we primed her skin with cysteamine 5% cream twice a day for 6 weeks prior to any procedural treatments. For her procedural treatments, we used anesthesia with compounded topical benzocaine, lidocaine, and tetracaine, as well as injectable lidocaine with epinephrine. She underwent 6 treatment sessions with the 785 nanometer picosecond titanium sapphire laser at 2 to 3 month intervals. After her first treatment with the picosecond laser, we also added on the 1550 non-ablative fractional laser for the latter 5 treatments. Our treatment parameters were set to target dermal pigment, and so our clinical endpoints were just mild erythema and edema. So here are before and afters for this patient. The left side is her baseline. The right side is 6 months after her 6th treatment with the laser. She had near complete resolution of the entire discoloration. So the benefits of this combination laser therapy are the synergistic effects. We know that the 785 nanometer picosecond laser has successfully treated venous stasis and hemosiderin hyperpigmentation. Comparatively, the 785 nanometer picosecond laser has a very slightly deeper depth of penetration, as well as a shorter pulse duration, allowing for specific targeting of the hemosiderin chromophore, for which the photoacoustic effect breaks up the melanin particles, allowing for tiny fragments to be disposed of. The non-ablative fractional laser uses the theory of selective photothermolysis. We've got these microchannels that are being created of thermal energy zones. So that, of course, does help with wound healing, but additionally helps with exfoliation of epidermal and dermal necrotic debris. So in combination with the picosecond laser, these fragmented particles of melanin that are being left over in the dermis are able to be extruded from the epidermis a lot easier with the combination of the fractional resurfacing laser. The cysteamine, we feel like, also played a role in clearing up this hyperpigmentation for this patient. We know that cysteamine is a thiol compound. It has a role that treats melasma, PIH, and lentiginous, but other hyperpigmentary conditions don't have as much evidence behind them. The cysteamine does play a role in inhibiting melanogenesis enzymes and has been shown to chelate iron ions, and for this reason, we specifically think that it really did help with hemosiderin hyperpigmentation. To our knowledge, this is the first reported case showing successful treatment of hemosiderin pigmentation using a combination of the 785 nanometer picosecond titanium sapphire laser and a 1550 nanometer non-ablative fractional laser. But of course, further large-scale studies are needed to better understand the efficacy in optimal treatment settings, along with the role of topical cysteamine for this particular indication. Thank you everyone for your time.